address some red flags that the applicant must avoid in their application.
So with that, it's gonna again tie to the point I mentioned on the previous question. You cannot lie on your CV. If you have low score, program's gonna see that. There's no point you can hide your low score. There's no point you can hide your attempts, right? That is where your personal statement comes in, where you can mention about if you had something significant that impacted your attempt on the exam, if there was something significant that affected your scores on the attempt. That is where your personal statement comes in, that I want to probably elaborate on that experience, like why that happened and how I overcame that in future, or how I overcame that to avoid making the same or having the same outcome again. So in your ERA CV, as I said, should be all facts, no emotions. Okay, this is all factual information about you, the type of experiences you did. That's why the timelines for your experiences, everything is in facts. Everything is in facts. Where we talk about emotions, where we talk about our personal insights is going to be your personal statement. That's why it's called personal, versus CV is something which is going to be uniform for everyone. So unfortunately, there's no way that you can avoid your red flags. If you have low score, you have attempts, that's going to show to the programs. You cannot hide those on your CV. Anyway, that is probably not part of your ERA CV. Your USMLE transcript goes as a separate document from the ECFMG, from ECFMG or the USMLE website directly to your ERAS application together in the whole bundle to the program. So they'll be able to see your scores, they'll be able to see your attempts, and they want to see those. That's part of your application. So there's, again, no way that you can avoid those red flags, and there's probably not any space on your ERA CV to address those red flags if we are specifically talking about scores and attempts. One thing I have seen people very intelligently using is the impactful experience, which is another section that they introduced into ERA CV in last 2 to 3 years. But again, you have to be very mindful of how you are using or expressing your impactful experience in that section of your ERA CV. People have used red flags in their application. For example, if someone, your ERA CV is going to include questions about, do you have any felony? Do you have any driving under influence? You have any like other law-related things that happened in your life? Because you cannot lie on those questions either. If you had something in your past, you have to say yes. That is where I have seen people using their impactful experience to elaborate on that question or that experience. Like, yes, I probably had a driving under influence, but then this is how it impacted me and this is how I overcame it. Is that a significant, impactful experience for them? Yes. And the way they explain it makes sense to the person. So that is going to make a big difference for me as an interviewee, that this is a candidate, one, who is honest about their experience. Second, they are elaborating, they are taking their chance to expand on how they corrected that mistake or how they corrected that red flag and how it's impacting their view of medicine or their role in medicine. Like, how has that impacted them to be a better physician or stand up for their team or stand up for their mistakes? So in nutshell, it's not like people want a person who is perfect in every regard. All of us make mistakes. We are human. If we are hiding those mistakes, is a bigger mistake than standing up for your mistakes and explaining them and telling them, like, this is how I overcame that mistake. So that's what I would say. Not lying on your experiences, and then unfortunately not enough room to explain your scores or attempts as red flags. That's likely more going to be for your personal statement. But using your impactful experience section, sometimes in an intelligent manner, as I shared an example, could be something that you can utilize to cover any red flag that you feel is on your application.